Hello and welcome. Today we're diving deep into a condition that can silently threaten your vision, retinal vein occlusion or RVO. This condition affects the blood vessels in the retina, the light-sensitive tissue at the back of your eye, and can lead to significant vision loss if left untreated. Join us as we explore the causes, symptoms, diagnosis, and management of this potentially devastating condition. So, what exactly causes retinal vein occlusion? Think of the retina as a complex network of roads, with arteries bringing blood in and veins carrying it out. RVO occurs when one of these veins becomes blocked, essentially creating a traffic jam. The primary culprit is often atherosclerosis, or hardening of the arteries, which puts pressure on the veins where they cross. Other contributing factors include high blood pressure, glaucoma, diabetes, blood disorders that increase the risk of clotting, and, less commonly, inflammatory conditions. It's important to remember that these are often risk factors that increase your likelihood of developing RVO, not direct causes in every case. Now, let's understand the pathophysiology, or how RV actually damages the eye. When a retinal vein becomes blocked, blood and fluid back up, causing increased pressure within the capillaries of the retina. This leads to swelling, or macular edema, and bleeding, or retinal hemorrhages. The blockage also deprives the retina of oxygen, a condition known as ischemia. Ischemia triggers the release of a protein called vascular endothelial growth factor, or VEGF, which stimulates the growth of new, abnormal blood vessels. These new vessels are fragile and prone to leakage, further contributing to swelling and bleeding. Over time, this can lead to permanent damage to the retina and significant vision loss. Retinal vein occlusion is a fairly common condition, particularly affecting older adults. Studies suggest that approximately 1 to 2% of individuals over the age of 40 will develop RVO. The prevalence increases with age, with those over 60 being at higher risk. Certain ethnic groups, such as African Americans, also appear to have a higher risk of developing RVO. It's also important to note that RVO often affects only one eye, but having it in one eye increases the risk of developing it in the other. The signs and symptoms of retinal vein occlusion can vary depending on the location and severity of the blockage. Many people experience a sudden, painless blurring or loss of vision in one eye. Others may notice floaters, dark spots, or distorted vision. The severity of vision loss can range from mild to severe. In some cases, especially with milder blockages, the symptoms may develop gradually over time. It's crucial to seek prompt medical attention if you experience any sudden or unexplained changes in your vision, as early diagnosis and treatment are essential for preserving sight. Diagnosing retinal vein occlusion involves a comprehensive eye exam performed by an ophthalmologist. This includes checking your visual acuity, examining the retina with a dilated eye exam, and measuring the pressure inside your eye. Several imaging techniques are also commonly used. Optical coherence tomography, or OCT, provides detailed cross-sectional images of the retina, allowing the doctor to visualize swelling and fluid buildup. Fluorescein angiography involves injecting a dye into a vein in your arm, and then taking pictures of the retinal blood vessels. This helps to identify the location and extent of the blockage, as well as any areas of leakage or abnormal blood vessel growth. These tests help the doctor confirm the diagnosis and determine the appropriate course of treatment. Retinal vein occlusion can be broadly classified into two main types: branch retinal vein occlusion, or BRVO, and central retinal vein occlusion, or CRVO. BRVO occurs when a smaller branch of the retinal vein is blocked, typically affecting only a portion of the retina. CRVO, on the other hand, involves a blockage of the main central retinal vein, impacting the entire retina. CRVO is generally more severe than BRVO and carries a higher risk of significant vision loss. Furthermore, both BRVO and CRVO can be further categorized based on the degree of ischemia present, which helps guide treatment decisions. The primary goals of treatment for retinal vein occlusion are to reduce swelling, prevent the growth of new abnormal blood vessels, and preserve vision. Anti-VEGF injections are the mainstay of treatment. These medications are injected directly into the eye and work by blocking the action of VEGF, thereby reducing swelling and preventing the growth of new, leaky blood vessels. Laser photocoagulation is another treatment option, used to seal off leaking blood vessels and reduce the risk of complications. In some cases, corticosteroids may be used to reduce inflammation and swelling. Treatment is often ongoing, requiring regular monitoring and injections to maintain its effectiveness. While there's no guaranteed way to prevent retinal vein occlusion, you can reduce your risk by managing modifiable risk factors. This includes controlling high blood pressure, diabetes, and high cholesterol through a healthy diet, regular exercise, and medication, if needed. Regular eye exams are also essential, especially if you have any of these risk factors. Early detection of RVO allows for prompt treatment, which can significantly improve your chances of preserving vision. Lifestyle modifications, such as quitting smoking, can also contribute to better overall eye health. The prognosis for retinal vein occlusion varies depending on several factors, including the type of occlusion, the severity of ischemia, and the promptness of treatment. With early diagnosis and appropriate treatment, many people with RVO can maintain useful vision. However, some individuals may experience permanent vision loss despite treatment. Ongoing research is focused on developing new and more effective treatments for RVO. This includes exploring novel anti-VEGF agents, gene therapy approaches, and strategies to improve blood flow to the retina. The future holds promise for even better outcomes for individuals affected by this vision-threatening condition.